All right, here we're going to talk about the lymphatic system. And the lymphatic system is something that's extremely important there, right? So you have the lymphatic system functions to transport clean fluids back to the blood, to drain excess fluids from tissues, to remove debris from cells of the body, and transport fats from the digestive system. So basically what happens is this, and that is, change this here. As blood's coming through from the arteries into the capillary beds, all right, and dropping off oxygen to the cells, and then it gets into the cap. So again, this area is called the capillary bed, all right, and then blood continues. The pressure decreases as it going back to the heart. So the pressure decreases. That's in the veins. That's why you have the valves. I think I talked about like another, so that the blood does not back up. You know. You have higher pressure in the arterial system, lower pressure in the veneal system, all right, but the pressure decreases. But I just want to kind of add that. But what happens is that some fluid actually is lost and is released into the intertissue space and is not reabsorbed into the capillary bed and back into the blood system. So what happens is that that extra fluid is actually absorbed in the lymphatic system. Okay. And then it goes to the lymphatic system. You have different organs as part of the lymphatic system and whatnot, right? And you have these lymph nodes and all that stuff. So basically, the lymphatic system is simply to clean up that fluid, that lymph fluid. It's kind of like maybe like a clearish, maybe milky type of fluid, to clean it up. All right, you're going to have the lymphocytes and other things there to try to clean it up, fight off cells and things that are not supposed to be there, all right, and then return that fluid back into the circulatory system, all right. So that is actually the main reason for the lymphatic system. Simply again to pick up that fluid that's lost, in a sense, clean it up and return it back to the circulatory system. All right, so some of the things regarding in terms of the lymphatic system organs: thymus, liver, spleen, lymph nodes. You know, sometimes if you might get like sick, you're not feeling well around, maybe like if you have like a sore throat or a cold, you might feel swelling around right here in your lymph nodes. Why? Because there's like a real like microbiological war going on right there, right? So that's just a part of the process. All right, talked about the lymphocytes that's made, from the lymphatic system. These are red blood cells here. All right, right here is the lymphocyte. Some just white blood cell that's a part of the immune system, a part of our defense mechanism. All right, so as I said again, blood comes from, it's leaving the heart, all right, through the arterioles, gets into what we call again the capillary bed, all right. So for the most part, the blood stays in the vessels because it is a closed system. Our circulatory system is a closed system, so it returns back, all right, towards the heart. However, some liquid is released from the capillary bed, from liquid again in the bloodstream is released from the capillary bed into the interstitial space, and again the lymphatic system, actually, which is an open system. See how these are not like connected. See here, there's like no connections. This is not connected to anything. It's just open. They will absorb the extra liquid, go through the lymphatic process, get cleaned up before it's returned back to the circulatory system. All right, and I think I mentioned about the lymph node, just kind of a close-up portion of the lymph node, receiving the lymph fluid, and of course the artery and the veins, they have to still receive blood to keep to keep working. Basically, the lymphatic capillaries, again, receiving, all right, lymph from the areas, all right, so that it can go into the lymph node. It's helped to kind of get cleaned up, all right, and that's helpful. Here it is like a swollen lymph node. I said, hey, how sometimes it gets swollen and inflamed. Here's a normal size lymph node. That's a swollen lymph node. A lot of times, again, like I said, say maybe if you have some sort of upper respiratory infection or a sore throat, and there's just like there's a microbiological battle and war that's going on there. So again, those lymph nodes that's close to it there, right, are going to be playing a pretty big role on some level or another in that battle. All right. So again, the lymphatic lymph, all right, that extra fluid from the blood vessels that did not return into the veins, all right, come here and then cleaned up. All right, so then you have what we call the right lymphatic duct and the thoracic duct. So here, let's use a different color. The right lymphatic duct. So what happens is this, all the things that I talked about there, right? This area in the right lymphatic duct, the activity is happening, so it's going to be returned back to the circulatory system. All right, so this part of the body right here on the right hand side, all right, all this activity is going to be returned to, so you have like the whole lymphatic system, all right, it's going to be returned back to the circulatory system. That occurs just like in this section of the body. It's on the right side. And then we call this the thoracic. The thoracic is actually, of course, this greenish area, and that includes actually the right side, kind of in the abdominal area and below. All right, not so much the abdominal torso area here and above, but again, the light green side, that's the thoracic duct. Okay, the thoracic duct. I guess they cannot call it the left lymphatic duct because it includes, you know, part of your right side, your right leg, and so on and so forth. So that is going to drain the lymphatic materials, and you know, it's going to all drain and pull from the arms, and the legs, and then eventually return into the bloodstream coming from this portion of the body. All right, thank you.